Today we are going to be explaining how to do a head-to-toe assessment. Head-to-toe assessments are normally used when someone gets admitted into the hospital, just it's literally a head-to-toe, just over the top, making sure everything's okay, and it's kind of like the baseline of what's going on with someone. So normally, this will be my patient. So you start off with the head, and normally you will check the hair, make sure there's no lice or anything, see if there's any lesions. And this is where you would ask, you can put your hat back on. This is where you would ask the patient, if they've been having any headaches, any blurred vision, anything that pretty much deals with the head. And as you keep going, then you go down to the eyes. And you also want to make sure the face is symmetrical. That's like the biggest thing. And then with the eyes, you would have a pen light and you would shine it into the eyes and you would check the dilation of their eyes to make sure they're equal, round, reactive, and accommodating. So you also then would go down to the mouth. You'd ask them if they have any dentures or if they have any partials. You'd also ask if they have hearing aids, glasses at this point. And you'd open up the mouth to assess the mucous membranes because that can tell how hydrated someone is as well. So next we go down and we would check out their range of motion in their arms and everything else. You check the carotid pulses. You never check the carotid pulses at the same time because that can actually cause someone to pass out. Next, you check all their pulses. So you check the brachial, you check the radial, and you want to have them squeeze your fingers both, make sure it's tight and that they're equal. You also then inspect the chest and you make sure that they don't have a barreled chest or anything, which could be a sign of COPD. And you then you palpate, which means you just touch and you feel for any irregularities, any abnormalities. And then you would auscultate or listen with your stethoscope. So when you do that, you start over here on the left, then you go to the right, down, over, and your left lobe actually has 3 lobes and your right has 2. So you always listen over on the side as well to be able to listen to that. And when that happens, you could also ask them to sit up and you want to listen to their posterior lung sounds as well. So it's the same concept as the front. You just go, left, right, down, back, over. And there's about 10 to 8 spots that you can check on the back. Normally they only do 8, but there are 10 spots. And then next you go down to the belly. You inspect. This one's a little bit different because all the others you inspect, palpate, then auscultate. On the abdomen, you inspect, auscultate, then palpate, because if you palpate before, you can actually start messing up their bowel sounds and you could get a wrong reading. So you always start in the left lower quadrant and you move in a clockwise formation. So, and normally you want at least 5 ticks in a sound because you have hyperactive, hypoactive, and absent is not a good sign. But hyperactive is, it's, over, hypo is under. So then you would palpate, feel if the abdomen's rigid, any, distension, anything like that. And this is where you would also ask about if they've had, their bowel movement, if they've been having any stomach pain, their urination patterns, all that kind of stuff. So then you move down to the legs. Your femoral pulses are right here. You normally check that to make sure there's circulation still going down, especially in hip replacement patients. That's a huge thing you want to check because there can be a loss of circulation and then they could lose their leg. So when you continue going down, you kind of check their range of motion here and make sure that they can move it well. And have you put this foot up too? So I'm going to have you push against me and then pull, and that just tells the strength. And then there's also two other pulses here. So you have your pedal pulses up here, and then your tibial pulses are right down here. And you want to make sure that they're equal as well. And one thing I forgot to mention is on the hands and toes, you check a cap refill, and that's where you just push on the nail and you let go, and you want it to color right away. Within 3 seconds, if it's greater than 3 seconds, then that is an issue, and you want to assess that further. So that is kind of a generic version of the head-to-toe assessment. If there are further, like if they have chest pains or shortness of breath, like you focus more there. Normally when they come in, you do a generalized, then you go to a focused. So it just kind of depends on what the patient is having, and hopefully this helps you understand a head-to-toe assessment better. Thank you.